Regular medical checkups become an essential part of maintaining our health. But did you know that not every test is always beneficial, especially for those over 70? In fact, some common screenings may do more harm than good in older adults due to overdiagnosis, unnecessary treatments, stress, and even complications from the procedures themselves. In this video, we'll explore 10 common medical tests that seniors over 70 should rethink, not necessarily avoid entirely, but question, discuss, and weigh the risks and benefits with their doctor. We'll explain what each test is, why it might be overused in seniors, and what alternative approach, if any, might be safer or more appropriate. This isn't about ignoring your health, quite the opposite. It's about practicing smart, personalized medicine that aligns with your actual risks, lifestyle, and quality of life. Let's dive in. Pushpin 1. PSA test for prostate cancer. The prostate-specific antigen, PSA, test measures a protein produced by the prostate. Elevated levels might suggest prostate cancer, but they can also be caused by benign issues like infections or enlarged prostate. The problem? In men over 70, prostate cancer is often slow-growing and not life-threatening. Studies show that many men die with prostate cancer, not because of it. Harms of unnecessary PSA screening in seniors. False positives leading to stress and biopsies. Overdiagnosis of slow-growing tumors. Side effects from treatment, incontinence, impotence. Guidelines. The U.S. Preventive Services Task Force, USPSTF, recommends that men over 70 should not be routinely screened for prostate cancer using the PSA test. Lightbulb: talk to your doctor if you have symptoms like trouble urinating, blood in urine, or unexplained pelvic pain. Mammograms after 75. Mammograms save lives by catching breast cancer early, but after age 75, the balance of risks versus benefits becomes murkier. Many seniors are at lower risk for aggressive breast cancer. Plus, the chance of dying from breast cancer is often lower than from other causes in this age group. Risks include false positives and unnecessary biopsies, anxiety and stress, overdiagnosis of non-life-threatening tumors. What experts say? The American Cancer Society says that for women 75 plus, screening should be based on individual health and life expectancy, not a one-size-fits-all model. If you have a life expectancy of more than 10 years and are in good health, continued screening may make sense. White heavy checkmark: the key is personalization. Screen if it benefits you, not just because it's routine. 3. Colonoscopy after 75. Colonoscopies detect colon cancer early, but they come with risks, especially for older adults. The procedure requires full sedation, bowel prep, which can cause dehydration, potential complications like bleeding or perforation. According to the USPSTF, routine colonoscopies are not recommended after age 75 for average-risk individuals. After 85, they should rarely be performed at all. Sparkles alternatives: fecal immunochemical test, FIT, or stool DNA tests like Cologuard, which are less invasive. White heavy checkmark: if you've had consistently normal results, you might not need another colonoscopy. Point 4. Bone density testing, DEXA. Too frequently. Bone density tests, or DEXA scans, help diagnose osteoporosis. But repeating them too often might not provide useful information. For seniors with no new fractures or risk factors, a DEXA every 5 years is usually sufficient. Yearly or biennial tests may cause unnecessary anxiety or lead to overtreatment. Warning: bone medications have serious side effects, jaw problems, fractures, so only start treatment if you're truly at risk. White heavy checkmark: stick to a reasonable screening interval. Discuss with your doctor. 5. Annual EKGs without symptoms. EKGs are useful for diagnosing heart issues, but not as general screening tools in healthy senior. If you're not having chest pain, palpitations, shortness of breath, then routine EKGs may lead to false alarms and more tests like stress tests or angiograms, which carry risks. According to Choosing Wisely and the American College of Cardiology, avoid annual EKGs in low-risk individuals without symptoms. White heavy checkmark: save EKGs for when you have symptoms or risk factors. Point 6. Imaging for back pain. Many seniors experience back pain. It's common, but jumping straight to imaging like MRI or CT can be a mistake.
Why?
Most back pain is mechanical and resolves in weeks. MRIs often find abnormalities that aren't the cause of pain, can lead to unnecessary surgery or painkillers. Guidelines say, avoid imaging unless you have red flags: weakness, numbness, cancer history, weight loss. White heavy checkmark: try physical therapy, gentle movement, and time before imaging. 7. Pap smears after 65. Cervical cancer screening with Pap smears is essential until it isn't. Women over 65 with adequate prior normal screening don't need Pap smears anymore.
Why?
Cervical cancer grows slowly. The risk after 65 is very low if prior tests were normal. False positives can lead to unnecessary follow-ups and anxiety. White heavy checkmark if you've had 3 normal Pap tests or 2 normal HPV tests in the last 10 years. You can stop. 8. Full body scans. You've probably seen ads offering full body scans just in case. Sounds great, right? Think again. These scans expose you to lots of radiation and often find harmless incidentalomas that lead to more scans, biopsies, unnecessary surgeries. There's no evidence they help people live longer or healthier. White heavy checkmark: only get scans if your doctor recommends them for a specific reason. 9. Vitamin D testing without symptoms. Vitamin D is important, but routine testing in all seniors isn't. Most people can get enough through modest sun exposure, diet, or low-dose supplements. Frequent testing leads to overtreatment with high-dose supplements, which may harm kidneys or increase fall risk. White heavy checkmark: unless you have osteoporosis, bone disease, or risk of malabsorption, you probably don't need a vitamin D test. 10. Preoperative tests for minor surgery. Having a cataract removed or a skin lesion biopsied. You probably don't need blood work, chest x-rays, or EKGs beforehand. Studies show routine pre-op tests don't improve outcomes for low-risk procedures. They add cost, delay treatment, and cause false positives. The American Society of Anesthesiologists recommends against routine testing for low-risk surgeries unless there's a specific medical concern. White heavy checkmark: trust your surgeon and anesthesia team. They'll order tests only if needed. Reoperative: being proactive about your health is incredibly important, but more testing doesn't always mean better care. Seniors over 70 face unique risks and priorities. At this stage of life, the goal should be quality, not quantity, living well, not chasing every possible diagnosis. The medical tests we've discussed can be life-saving in the right context, but harmful if overused. Here's what you can do. Review your health screenings with your doctor each year. Ask, what will I do with the results? Consider your personal values, life expectancy, and current health. Folded hands. Thanks for watching. If you found this video helpful, please like, share, and subscribe for more health-focused content aimed at helping you and your loved ones age wisely.